Cognitive behavioral therapy, or CBT for short, is a form of psychotherapy that focuses on the connection between our thoughts, feelings, and behavior. It's based on the idea that our thoughts, feelings, and behaviors are all interconnected, and that by changing the way we think, we can also change the way we behave and feel. I'm Camilla, I'm a psychologist, and I'm on a mission to spread mental health awareness and make better mental well-being available to more people. CBT is a practical, action-oriented, and goal-directed form of therapy. It helps people identify their negative and distorted thought patterns and replace them with more positive and more realistic ones. This can lead to a reduction in our emotional distress and an improvement in our behaviors. So what can cognitive behavioral therapy be used as treatment for? Cognitive behavioral therapy is used to treat a wide variety of mental health issues such as anger problems, anxiety and panic attacks, stress, bipolar disorder, PTSD, depression, OCD, phobias, drug and alcohol problems, and schizophrenia. In some cases, there are variations of the method to treat specific problems. For example, trauma-focused cognitive behavioral therapy, which is used in treating PTSD. Cognitive behavioral therapy has shown to be particularly effective for treating stress, anxiety, and depression. In fact, it's the most commonly used approach to treating these exact problems. So what can you expect from a typical cognitive behavioral therapy session? There are obviously individual differences between different psychologists and therapists, but a CBT session is usually between 45 minutes and 60 minutes long. I personally practice 60-minute therapy sessions. During a typical CBT session, the therapist or the psychologist will help the client to identify negative thoughts. They might assess the evidence together going for and against these thoughts, and then they might work to develop alternative and more balanced perspectives. CBT often involves activities for you to do outside of your sessions as well. This might be filling out worksheets to track situations and thought patterns, or it might be filling out journals. When I use CBT in my therapy sessions, I always give my clients homework. I like to say that while a lot happens during the therapy sessions, it's actually between sessions that the real magic happens. This is where the client experiments with trying out new tools and skills that they've learned during the sessions, and they find out what works and what doesn't work. This is also where we practice until our new learned skills become habits. So one of my typical CBT sessions would have 3 main parts to it. The first part would be assessing and evaluating what's happened since last session. How's it gone with the homework? Has the client been able to introduce and use some of the skills and methods that we discussed last time? Now, it's really important to both discuss the things that have worked well and the things that haven't worked so well. This is where we learn and adapt and find the skills and methods that work exactly for us. We all find that different things are particularly useful for us. So this is a really important step of finding out what you need and what you find helpful. Then the second part will typically be diving another layer deeper into the thoughts, feelings, behaviors that the clients experience. This is where I might introduce new tools or new psychoeducation to the client. Psychoeducation is what we call it when we teach our client about their own cognition, about their own psychology. Often being able to understand what we're experiencing and why we're experiencing this can help us to actually take control in the situations. And finally, the third part will be looking at what the homework is for next session. What are the things that I'd like you to practice? What are the things I'd like you to be aware of? I often like to think of this stage as an exploration stage, where we're constantly trying to understand our own cognition better. The more we understand the connection between our own thoughts, feelings, and behaviors, the easier it is to work with it. So essentially, cognitive behavioral therapy and the psychoeducation within that can help give the tools and the understanding that we need to improve. But it's the client that needs to do the legwork and really try these things out in between sessions to truly see the real benefit of it. Some of the very common exercise within cognitive behavioral therapy can be to identify and record unwanted or negative thoughts, to find replacements and alternatives for those thoughts, and then to continuously notice when the negative thoughts are there and actively replace them with the alternative thought. So I'll give you an example of someone struggling with anxiety and how you might in that situation replace a negative thought with a more positive one. We might have a thought like, I'm not good enough. And because of that thought, we might feel nervous and anxious in social situations. In cognitive behavioral therapy, we'd look at replacing that thought with a more positive and more realistic one. This could be, I am capable and I am worthy. By changing this negative thought pattern, this person will feel less nervous and less anxious in social situations. Now, this is obviously not something that just happens magically by me telling the client, you need to think more positively. It's unfortunately not as easy as that. It does take some therapeutic legwork of finding out why this negative thought has occurred in the first place. Where does it stem from? And from then we can work on replacing it. So what kind of outlook and timeline should you expect? While a typical course of CBT treatments usually lasts 10 to 20 sessions, your work doesn't necessarily finish there. Once your therapy period is completed, you'll need to make sure that you keep up with and maintain the good habits that you've created while you've been in therapy. I sometimes see clients who've gone through big improvements while they've been in therapy and for a while after, but then maybe a year later, they'll contact me again and explain that they're starting to see some of the symptoms they were experiencing before the therapy. Now, thankfully, if they react early when they start seeing the beginning symptoms, it takes very little adjustments to get them back on track. Often it'll just require 1 or 2 booster sessions to get them back into the habits of using the tools that they know from CBT. But what if you don't find cognitive behavioral therapy useful? Although many people do find CBT useful, not everybody does. This goes for any form of therapy. If you've tried therapy that didn't help you, it's important that you don't blame yourself or think that nothing can help you. We all respond differently to different types of therapy, and I'd encourage you to not feel disheartened if you don't see the changes and improvements that you want. Simply try something different. Another really important aspect of therapy, any therapy, regardless of therapeutic approach, is the relationship between the therapist and the client. If you feel like the chemistry isn't right between you and your therapist, it's perfectly acceptable and normal to find another therapist. Again, it's really important that you don't come to the conclusion that you can't be helped or that therapy isn't for you at all. We just know that a good therapist-client match is crucial to seeing good results from therapy. So don't hesitate to find another therapist if you don't feel like the match is right for you. In my practice, I like to combine cognitive behavioral therapy with many other methods and theories and approaches within psychology. I believe that it's important that the psychological approaches and the treatment is adapted for the specific person and their specific difficulties. So it is possible to combine cognitive behavioral therapy with other forms of therapy, but you will also see some practitioners dedicate themselves completely to one specific approach. So the principles of cognitive behavioral therapy can be used either on their own or in combination with other forms of therapy. I explain new psychological topics or concepts every single week. Make sure to subscribe to not miss out on the next one. If there's any topic that you would like me to cover, please leave in a comment down below and I'll look into it. I hope to see you next time. Take care and bye for now.